Hi, welcome to my channel Semper Astra. My name is Maggie, and in today's video I will talk about things which in my experience are very useful when we are in the process of getting ready to go through eye removal surgery. At the beginning of this video, I would like to emphasize that I am not medically trained. I am just a blind person who went through eye removal surgery. In fact, I lost both of my eyes, and who wants to share with you her own experiences. When I was preparing to record this video, I decided that I am not going to use any medical terms because I don't want to place myself in a position of an expert when I am talking about topics in which I am not an expert. I believe that it will be best if I talk to you as a friend who wants to be supportive and who wants to give you helpful tips. Before I start discussing points that I have prepared for today, and there is 6 of them, I will tell you a little bit about my own situation to give you a little bit of context. So I never was fully sighted person. Until I was 15 years old, I had low vision. So, for example, I could see enough to be able to walk independently, and I didn't need any help from other people. I wasn't using guide dog, I wasn't using long cane. I also was able to ride a bike independently, which I really enjoyed. When I was writing, I could use a normal biro pen and I was able to read my own handwriting, and this situation was until I was 13 years old. And then from the age of 13 years old till the age of 15 years old, to be able to read my own writing, I had to use thicker markers or like felt pens. And for instance, at school, although I was always sitting in the front row, I was never able to read anything from the blackboard. And for example, when I was watching TV, to be able to see everything, I had to sit very close to the TV. When I was 15, I lost all of my useful vision, and since then I was functioning as a blind person. And for another 4 years, I was able to see some light. But when my eyes were removed, and that was at the age of 24, then I wasn't able to see anything. I couldn't even see light. My eyes were removed because for many, many years I was suffering from glaucoma, and high pressure in my eyes caused a lot of damage. And also, to save my sight, I received lots of surgeries, which unfortunately in the end also caused damage to my eyes. So when I was about 23 and 24, unfortunately I was suffering from a lot of pain, which was unbearable. And also I was experiencing chronic, very severe inflammation, which was causing a lot of health problems. So now I will start discussing points that I have prepared for today. So in the first place, from my experience, it is very important that before we go through eye removal surgery, we discuss with our surgeon all type of surgeries that are available, and that we understand which type is the best for us and why. So I just wanted to mention very briefly that there are roughly 3 types of, like in generally speaking, there are 3 types of eye removal surgery, and they differ from one another depending on how much tissue is removed from the eye socket. So the person like me who has complications because of glaucoma will need totally different surgery than the person who, for instance, had an accident. And also, a lot depends on what the accident was and how much damage the accident caused. So also there is like additional variation. And also, different surgery will be needed by a person who is suffering from cancer and for whom this surgery is life-saving surgery. Another thing which is also important to discuss before having eye removal surgery, and this is still under point 1, this is just point kind of B in point 1, is whether we will be able to have an implant and what sort of implant we are going to have, if we are able to have one. So there are many implants, and they differ from one another depending from which material they are made of, and also depending on what is their structure. And the last thing which is worth discussing before having the surgery, and this is point C, 2.1, is what sort of prosthetic will be the best for us after our eye socket heals from the surgery. So I will now briefly talk about the difference between implant and prosthetic and artificial eye, and just keep in mind that I will talk strictly only about my situation, and everybody's situation may be different, but just to make it kind of clear and I will just refer to my own example. But just keep in mind that your situation may be slightly different. So in my situation, because my eye was very damaged by glaucoma, my entire eye and all of the walls of the eye were removed. The optical nerve was cut, but the muscles that are moving the eye were preserved, and they were attached to my implant. My initial implant was made out of artificial material, and it was sort of wrapped in my own tissue, in my own conjunctiva, and it was kind of sewn, so it was totally covered by my own tissue. And when my wounds, when the wound from the surgery healed, I received acrylic plastic prosthetic, which is sitting under my eyelids on the top of the implant that is covered by my own tissue. So we could compare this kind of mechanics to wearing contact lens. So the contact lens would be a prosthetic, and the implant is playing function of an eye. And because my implant was attached to the muscles, the implant was moving, and that was also giving movement to a prosthetic. So I am able to move my eyes up and down, and kind of people may see that I have movement in my eyes, which of course it is like my implants and my prosthetics, but it looks kind of more natural. So now I will discuss why, in my opinion, it is very important to have all of this information and understanding before going through the surgery. So, when I realized that the best option for me is to have my eyes removed, this information was very upsetting for me and very overwhelming, and I simply wasn't able to absorb any details about the surgery. What is it going to look like? What the recovery is going to be like? I just had in my head this one thought, that I am irreversibly losing my eyes. And I vaguely remember the doctor who was looking after me telling me about how the implant works and how the prosthetic works, but I didn't take any details. And when many years later I kind of realized how many options there are for the surgery, for the implant, for the prosthetic, for like a fleeting moment, I had this thought, oh gosh, did I choose the best option for myself? Am I sure that the best option was offered to me? And luckily, the doctors who look for me now gave me all of the information which reassured me that I made the best decision and the best option was offered to me. But unfortunately, I know many people who also initially were not clearly aware of all of the options, and now they regret that they didn't have a different type of the surgery, that they didn't have different type of an implant, and they wish they would have more information then, because they would make then different decision. And also, I strongly believe that more information we have about our health, more information we have about our treatment options, then we accept easier our choices and the consequences of our choices. And even if we have some complications later on, we know why we made this choice at the time. And we also understand that if we made a different choice, there also could be negative consequences. So please don't hesitate to ask questions. Please give yourself time to ask questions, and make sure that you have whole understanding and full understanding of your options and of why certain options are better for you than others. The second thing that I want to discuss today is the importance of discussing with your doctor, with your surgeon, how are you going to feel directly after the surgery, how are you going to feel when your dressings is removed, and how are you going to feel during recovery time, and what is your life is going to be without your eyes, with your implants, with your prosthetics. So I don't know why, but when I was waiting for my surgery, although I kind of vaguely understood that I'm going to have an implant, that I will still have some movement, I had this irrational fear that my eye socket will be very, very deep and that it will be frightening. And I was also worried, how is it going to feel not to have my eyes? And I was really worried that I will kind of feel paralyzed in the area of my eye sockets. And I was worried, how is it going to feel if I would want to just want to look up or down or left or right, when I will have this kind of reflex need, and how will that feel? Will I be able to do it? And also I was really worried that pain after the surgery will be unmanageable, and none of my fears came true. In the first place, my eye sockets were never frighteningly deep, even when I had periods of my life when my implant was collapsed, when it kind of lost volume, it still wasn't frighteningly deep. I never lost control over my muscles, and it literally feels the same. My prosthetic and my implant feels the same as my eye did. The only difference is that I no more have pain and I no more have inflammation. Well, I have some pain sometimes, but it's never the same volume of pain. And also the pain after the surgery, well, of course there is pain, but it was manageable with medication. So I really kind of recommend that, again, you don't hesitate to ask questions, and remember that the doctor don't know our thoughts. They're unable to guess what our worries are, so they're unable to reassure us because they don't know what we are really thinking. And this is why sometimes they don't tell us things, because they don't know that we are worried about, things. And probably we're sometimes worrying about things that other people don't even think about. Okay, now I will move to point 3. And point 3 is about the fact that when I was waiting for my eye removal surgery, I was thinking, okay, I'm losing my eyes irreversibly, but at least I will never have to the doctor again. I will never have to go to the hospital again, end of my eye drama. And that wasn't the case. it is important to understand that we need to continue looking after our prosthetics, after our implants, after our eye sockets. It is important to regularly visit artificial eye center, or I think that in the United States we call them the ocularist. So it is important to have regular checkups, and when the ocularist or when the person in artificial eye center notices that there is something bad happening, we may have to continue going to ophthalmologist. And unfortunately, I had serious complications about which I will tell you about. So unfortunately, 12 months after my eyes were removed and 12 months after I received implants made out of artificial material, my body rejected these implants and they had to be removed, and I received implants which were made out of my own tissue. They were made out of my own fat and skin, and for a long time it worked, but unfortunately after nearly 20 years the implants started to shrink. They started sort of to collapse, to lose volume, and the smaller the implant was, then the bigger prosthetic needed to be, and that started to become very uncomfortable, painful. It kind of felt as if I was wearing wrong size of shoes, and also my eye socket started to feel very dry. But luckily 2 months ago I had surgery that fixed all of these problems, and it worked very, very well. I can say that it worked spectacularly well, and now I'm back to where I wanted to be. My implants have now optimal size, and again I have light and small prosthetics, and my eyes are also well lubricated. I don't need to use any artificial ointments or tears. So as you can say, in the first place, we need to still look after our eye sockets, but also there may be complications, but it is also important to remember that in my case and in situations of many other people that I know of, whenever the complications occurred, also in great majority of cases, they were good solutions for these complications. So there is a bad and good in that point. Now, the fourth point is about the importance of ensuring that before we undergo the surgery, before we undergo eye removal surgery, it is important to ensure that we don't suffer from any other health problems that may have negative impact on the outcome of the surgery. So again, I will refer to my own example. So in the past, during many surgeries, I was bleeding excessively during the surgery and during the healing progress. And it was not only during eye surgeries. I had this problem, for instance, when I had surgery on my nose, on the surgery on my neck. And a couple of years ago, I had like a very detailed interview, and I shared this problem, and this problem was investigated in a lot of details very thoroughly, and it was identified that I have bleeding disorder problem, and now I am under care of hemophilia center, and a special treatment plan was developed for me. I take special medication before the surgery, during the surgery, and after the surgery, and my recent surgeries were very successful. I didn't have this problem at all. In fact, after this most recent surgery, when the dressings were removed, there was no even one drop of blood on them, and the doctors believe that probably my previous complications during my previous surgeries were probably caused to some extent by this bleeding disorder, and also it is believed that the success of these recent surgeries is also thanks to the fact that this problem with bleeding is resolved with the help of medication. Now, the point number 5 is relevant to people who had both eyes removed, and also in particular to people who lost both eyes in adulthood. So unfortunately, after I lost my both eyes, after they were removed, I started to suffer from sleeping disorder. And now I understand, but I didn't know it for a long time, and I didn't understand this link. Now I understand that when I had my eyes, although I couldn't see with them, they were still receiving light, retina, although I couldn't see with it, it was still receiving light signal, and although also my retina and my optical nerve were damaged to great extent, they were still conducting the signals about the light to my brain. So although I was blind, my eyes were still passing the signal about day and light to my brain, and my brain knew when it was day and when it was light. Unfortunately, when my eyes were removed, the retinas were removed, the eye optical nerve was cut, and my brain stopped receiving signal about light and night and no light. And this is what causes my difficulties with sleeping disorder. And I just want to make it very clear that I don't blame the doctor who operated on me for not telling me about this, because I had my eye surgery, this surgery 20 years ago, and then there was literally no research about that. And also I understand that there are so few people in the world who lose both eyes in adulthood that there is no data, there is no subjects to make clinical research on. So nobody was talking about this problem then. Now there is more information about this. Now people talk about this more, and now I understand what is happening to me. Unfortunately, for many years I didn't make this link, and I was blaming myself for not looking after myself well enough. And I was thinking, oh Maggie, you're a student, you just study overnight, you are talking to your friends till late night, so you don't sleep enough, then you're napping throughout the day between your classes, so of course you struggle with your sleep. And I only started to ask for medical support and started talking to the doctor about this problem when I started full-time job from 9 to 5, and when I couldn't nap throughout the day, when I was making sure that I go to bed every day at the same time. I was doing everything in line with sleep hygiene protocol, and I still struggled. And only then I was told about what is causing my sleep problem, and I stopped blaming myself. And although there is no solution, there is no perfect solution for this problem, I receive some sort of help. And I'm not going to go to details of this because this is too much details for this video. And also I don't want to go to too many details about that, because all of the solutions are very imperfect, unfortunately. But my life is easier since I understand the connection between losing my eyes and having the problem with sleeping. And I am also kinder to myself, more understanding to myself, and also I am able to share this difficulty with other people and receive support, even mental support from my friends, that they understand. And I also want to emphasize that although it is hard, this didn't ruin my life. I'm still able to work full time. I'm still able to do my hobbies, to have active life, to have friends. It is just much harder. Okay, so now I will move to point 6, and this is the last point, and it is all about the fact that when I was losing my eyes, and of course that was very traumatic experience for me. Well, of course, no, I shouldn't use the word of course. It was just very traumatic experience for me. I never expected that I will have some positive gains from this surgery that I didn't expect, but I have. unexpected gain. So when I was getting ready for this really difficult surgery, I was never thinking, I was just thinking about that it is irreversible, what I mean, that I will never get my eyes back. And I was only thinking about sad aspects of the surgery. But I was never thinking that I will have a surprise about the fact that I aesthetically look much better. And now I understand that my eyes were very damaged by glaucoma. They were also very damaged by the surgeries, and they looked very poorly. They looked like very, very ill, damaged eyes. And since I received implants that enable me to have some movement of eye muscles, and since I received artificial eyes, my prosthetics that look very natural, I simply look aesthetically much better. I receive a lot of positive feedback about the way I look, about the way my eyes look, and that helps my confidence, and it just feels really, really nice to have nice eyes. So to summarize, if you are currently in the situation when you're waiting for eye removal surgery, or if your loved one is waiting for the surgery, I wish you lots of strength, lots of courage, and I hope that you have many supportive people around you. And please don't hesitate to talk about your anxieties, about your fears. Don't hesitate to ask questions. Give yourself a lot of time and be kind to yourself. And I wish you all the best for this difficult time and for your recovery. And I hope to see you in my next videos. Bye bye.